Welcome back YouTubers to my channel of an everyday life of an Aspie. If you're new, I welcome you all. I'm Aspie. I'm all about creating mental health and awareness and sharing my life stories with Asperger's syndrome, along with tips and advice along the way, and hopefully in saying there's some fun and games. So if you're into any of these, feel free to join me on the bandwagon by smashing the subscribe button on the bottom right hand corner of the screen, as well as also turning on the notification bell so you don't miss any future videos like these or any other future video updates that might come to effect. So as you're aware, as I said before, that I'm doing all about drug awareness right now while I'm waiting upon obviously some people that are participating in my project for next month. So this one is episode 1 part 6, which is your drug type of dissociatives. So if you're watching right now, hopefully you've learned something. Please let me know what you've learned so far from these videos that I'm actually, sharing with you all, of maybe the symptoms that you didn't know that was coming effect, or something you may have learned after, witnessing one of your friends or family members that went through a drug abuse or drug addiction phase. How did you go about it maybe? And so this, just to give me a heads up, as well as others, just by commenting below so that we can start the conversation. Dissociatives is a form or a class of hallucinogens which distorts perception of sight, sound, and produces feelings of attachment, or shall I say detachment, as well as dissociation from the environment and themselves. This is done through reducing or blocking the signals from the brain that are important of the neurotransmitters in our conscious mind, from other parts of the brain. Although many kinds of drugs are capable of such action like this, dissociatives are unique in that they do in such a way that they produce hallucinogenic effects, which may include sensory deprivation, dissociation, hallucinations, and dreamlike states or trances. Some which are non-selective in action, however, and affect the dopamine and or opioid systems, may be capable of inducing euphoria. Many dissociatives, however, have general depressant effects and can produce sedation, respiratory depression, analgesia, anesthesia, ataxia, as well as cognitive and memory impairment. And laboratory studies have suggested that this dissociative drugs, including PCP, ketamine, and DXM, cause the effects by disrupting the actions of the brain chemical glutamate at certain types of receptors that's called the N-methyl-D-aspartate or NMDA receptors on nerve cells throughout the brain. Glutamate plays a major role in the cognition, including the learning and memory side of things of our brain, emotion, and the perception of pain. The latter via activation of pain-regulating cells outside of the brain. PCP also alters the actions of dopamine, a neurotransmitter responsible for the euphoria and rush associated with many abuse, are as follows: your nitrous oxide or nitrous, NOS, hippie, crack, ketamine, K, special K, Cat Cat or Cat Valium, which obviously are the common names here as well. Detroxymetriphan is Robo, penocyclidine is your angel dust, ozone, rocket fuel, love boat, hawk, embalming fluid, supersatives. The effects of dissociatives can include sensory dissociation, hallucinations, mania, cataplexy, analgesia, and amnesia. According to Pender 1972, the state has been designated as dissociative anesthesia since the patient truly seems dissociated from his or her environment. Bonta 2004 stated or described dissociative anesthesia as a peculiar anesthetic state in which marked sensory loss, analgesia, as well as amnesia isn't accompanied by actual loss of consciousness. Both Pender 1970 and Johnson et al. 1959, however, reported that patients under anesthesia due to either ketamine or phencyclidine are prone or were prone to purposeless movements and had hallucinations or dreams during and after anesthesia. Some patients found the hallucinations euphoric, while others found them really disturbing. At sub-anesthetic doses, however, dissociatives can or may alter many of the same cognitive and perceptual processes affected by other hallucinogenic drugs. such as mescaline, LSD, and psilocybin. Hence, they are also considered hallucinogenic and psychedelic. Perhaps the most significant subjective difference, however, between dissociatives and the classical hallucinogens such as LSD and mescaline are the dissociative effects, including depersonalization, the feeling of being unreal, disconnected from oneself, or unable to control one's actions, and derealization, the feeling that the outside world is unreal or as if they're dreaming. Most dissociative drugs work by interfering with the action of glutamate, the most abundant neurotransmitter in the brain that signals the molecule in the brain. Glutamate's role is largely excitatory, meaning that it causes the nerve cells to fire up the signals to their neighbors of these neurotransmitters. Dissociative drugs, however, work by traveling to the nerve cell on the receiving end of the signal and blocking out its receptors. This prevents glutamate from docking with the cell and carrying the signal onwards. By blocking these nerve signals in the brain, dissociatives has an anesthetic effect. They also cause the user to feel dissociated, detached, or removed. Possible effects of dissociative drugs may include the following: numbness and reduced ability to feel pain, immobility, distortion of sensory input such as your sounds or images, altered perception of time, hallucinations, loss of memory, elevated mood or euphoria, paranoia or delusions, dreamlike feelings, depersonalization, feeling like you're watching yourself from afar without having any control over your own actions, derealization, which is your feeling that the world around you isn't real, dizziness, suicidal impulses, mania, dilated pupils, changes in the heart rate or your blood pressure, red skin, nausea, vomiting, salivating, tremors, or muscle twitches. To look out for. While the long-term use of the dissociative drugs hasn't yet been investigated, however, systematically, research has shown that repeated use of PCP can lead to tolerance and the development of a substance use disorder. That includes a withdrawal symptom, including cravings of the drug, headaches, and sweating. When drug use is stopped. Other effects of long-term PCP, however, use includes persistent speech difficulties, memory loss, depression, suicidal thoughts, anxiety, and social withdrawal that may persist for a year or more after the chronic use has been stopped. Low to moderate doses to look out for is your numbness, loss of coordination, disorientation and confusion, dizziness, nausea, vomiting, changes in sensory perceptions from your sight, sound, shapes, time, body images, hallucinations, feelings of detachment from oneself and the environment, increased blood pressure, heart rate, respiration and body temperature, high doses. Hallucinations, memory loss, physical distress, including dangerous changes in blood pressure, heart rate, respiration and body temperature. Physical distress, including dangerous changes in blood pressure. Marked psychological distress, including feelings of extreme panic, fear, anxiety, paranoia, invulnerability, exaggerated strength and aggression, used with high doses of alcohol or other depressants can lead to respiratory distress or arrest, resulting in death. Each individual dissociated drug has its own distinct effects, however, in addition to the above general effects. Dissociative drugs can produce visual and auditory distortions and a sense of floating in dissociation, feeling detached from the body in users. Use of dissociative drugs can also cause anxiety, memory loss, and impaired motor function, including body tremors and numbness. These effects, which depend on the amount of drug has been taken, are also unpredictably, typically beginning within minutes of ingestion and lasting several hours, although some users report feeling the drug's effects for days on end. For many individuals, the first step toward recovery for any drug abuse or substance abuse is acknowledging their own personal struggles with substance dependence. The next step after this is finding a treatment program that will help you and them to restore their overall health, well-being, and happiness. There are countless treatment options out there that a person can choose from, depending where you are in the around the world. For example, some people with severe forms of addiction may enter a detox program before transitioning into rehab. Others may choose to begin recovery at an inpatient or outpatient facility. After treatment is recommended to continue reinforcing the lessons learned in rehab by attending support groups and therapy sessions as well as counseling. Remember, there's no such thing as a one-size-fits-all for everybody approach to addiction recovery. Whichever treatment path they choose, be sure that it has everything that they need to help them to achieve a successful recovery. Recovering from addiction isn't easy. It will take a significant amount of willpower and self-discipline to achieve and maintain long-term sobriety. However, you're never alone in this journey. During rehab, you'll build strong relationships with others in recovery who can relate to what you were going through. In addition to all this, your family, friends, and other loved ones around you has your best interests at heart during this time while you're going through recovery. Your recovery from an addiction is dependent on how much you put into the process yourself by choice. Treatment available your treatment programs are different for each individual, as I said, and are customized based on their unique needs and situations. The most effective types of treatment programs ensure that individuals in recovery are actively involved every step of the way. Inpatient rehabs offer structured treatment programs designed to address all facets of an individual's addiction. During inpatient rehab, patients reside in a substance-free facility and receive around-the-clock medical care and therapeutic support. Inpatient rehabs are the best option for individuals battling chronic addiction, as well as those who suffer from occurring mental or behavioral disorder. Outpatient rehabs is another form of comprehensive addiction care. These programs offer the same kind of effective treatments and therapies such as inpatient rehabs. However, outpatient rehabs allow patients to live at home during the recovery process. Patients can continue working and caring for their families while attending scheduled treatment sessions throughout the week. It's important to bear in mind, though, to keep in mind also that outpatient rehabs don't take place in residential facilities. Therefore, patients are at a greater risk of encountering triggers that may challenge their sobriety. Because of this, outpatient rehabs are most suitable for individuals with mild forms of addiction and a committed, disciplined approach to recovery. Detoxification helps people safely withdraw from their use of drugs or alcohol in the home until it's no longer present in the system. It's often the first step in treating individuals recovering from moderate to severe forms of addiction. In some cases, detoxing from certain drugs requires medication or system therapy to help ease the severity of withdrawal symptoms. Medications prescribed during detox are often tapered down until the patient is no longer physically dependent on any addictive substances. Detoxification or detox is the process of letting the body remove the drugs in it. The purpose of detox is to safely manage withdrawal symptoms when someone stops taking drugs or alcohol. Everyone has a different experience with detox. However, the type of drugs and how long it was used affect what detox will be like for each person. Medications used in detox basically will help keep former users comfortable while the drugs leaves the body. It can take days or months to get through the withdrawal symptoms for most drugs. The length of withdrawal depends on the drugs and how heavily they were used in the first place. Speak with someone who can help you find a medically assisted detox now if need be, if you feel it's right for them. You can. Choosing to detox at home can be deadly though. However, quitting cold turkey without medical supervision can lead to serious issues such as dehydration, seizures, and much more. There are inpatient and outpatient detox programs that help prevent dangerous complications. People with severe addiction should seek professional help or inpatient detox centers because withdrawal can be fatal. Inpatient detox includes 24-hour support and monitoring of their detoxification. Everybody's needs are different for detoxing. The drug detox process helps addicted people to get personalized treatment. In most cases, the process involves 3 steps: evaluation, the medical term screenings, incoming patients for physical and mental health issues. Doctors then will use blood tests to measure the amount of drugs in the inpatient system. This will help determine the level of medications that are needed and required to do this. There's also a comprehensive review of drug, medical, and psychiatric histories to be recorded. This information sets up for the basis of patient's long-term treatment plan to put into play. This is to stabilize the patient with medical and psychological therapy. The goal of stabilization is to prevent any form of harm to the patient. Doctors can prescribe addiction treatment medication to prevent any more complications and reduce withdrawal symptoms. This is the last and final step of the detox process, which is a preparation for a treatment program that will best suit the need for others. Doctors will then familiarize their patients with the treatment process and what to expect. Inpatient rehab offers the best chances of success after detoxing. If detox takes place in an inpatient program, this last step is crucial to keep patients on track. Obviously, as we know, can be painful and dangerous. This is why medical detox is also important. Detox with medical supervision allows patients to detox in a safe and comfortable environment. The extent of supervision is different in inpatient and outpatient rehabs. A medically supervised detox prevents dangerous complications of drug and alcohol withdrawals. Although medical detox limits the symptoms of withdrawals, some are unavoidable. Some of the most common side effects may include nervousness or anxiety, insomnia, nausea, muscle weakness, and mood swings. Quickly ends a video based on dissociatives. Smash the like if you like this. Feel free to comment below. Feel free to share these videos around. Feel free to follow me on my social medias. Feel free to also, as I said before, as I've got an online store that's pretty much readily available for anyone of you that may be interested in looking into my merch and whatnot. And yet, anyone that is interested in buying any of my merch, you get 15% off till the end of the month, so to speak. So, no further ado, guys. Thanks for watching. Do you love you.